Hi, I'm Francis, and today we're going to be doing spine range of motion, cervical extension. The axis of rotation is going to be the external acoustic medius. The stationary arm is going to be perpendicular to the ground. The mobile arm is going to be aligned with the bottom of the nose. So, right here, when you're ready, go ahead and extend your head back. Good job. Report 55. Normal range of motion is 60 degrees. This occurs in the sagittal plane, and the target muscle is the spinous cervix. Hi, I'm Francis, and today we're going to be doing the manual muscle test for your external obliques. Your external obliques originate at ribs 12 through 4. They insert at the iliac crest, linea alba, ASIS, and your pubic crest. The action of this is it flexes and laterally bends the trunk. I'm going to have, in the plane of motion that occurs is the sagittal and transverse plane. I'm going to have my partner lie supine on the mat and have her bring her hands behind her head. She's going to do a crunch and a diagonal motion. She's going to crunch up and have her elbow go to her opposite knee. To get a grade 5, her inferior scapula needs to clear the mat table. Report 5. Hi, I'm Francis, and today we're going to be doing range of motion, shoulder abduction. A normal shoulder range of motion for abduction is 180 degrees, and the muscle we're targeting today is the middle deltoid. The plane of motion that this occurs in is the frontal plane. I'm going to instruct my partner to lie down on the mat table. The axis of rotation is her anterior aspect of her acromion. And then the stationary arm is going to be parallel to her thorax, and the mobile arm is going to be in the midline of her humerus. And when she's ready, I'm going to have her abduct her arm. Go ahead. Great job. That's 170 degrees. Hi, I'm Francis, and today we're going to be doing the Tensor Fascia Latae muscle test. The origin is the iliac crest. It inserts at the iliotibial tract, and its action is hip flexion, hip abduction, and hip internal rotation. The actions occur in the sagittal, transverse, and frontal plane. So I'm going to have my patient lie down on your side. You're going to bend your bottom leg for balance. You're going to lift your top leg 30 degrees and flex it 45 degrees. My first hand is going to go on her iliac crest. My second hand is going to go to proximal to the knee joint on her distal thigh. I'm going to resist downward as she resists upward. Ready, go. Good job. Report 5. I am Francis, and today we're doing the manual muscle test for the middle deltoid. The origin is the acromion process. It inserts at the deltoid tuberosity, and its action is abduction of the glenohumeral joint. This action occurs in the frontal plane. Now we're going to do the manual muscle test. So I'm going to instruct my patient to go ahead and sit on the mat table and put your shoulder and elbow into 90 degrees abduction. I'm going to put my first hand in the midline of the clavicle, and my second hand is going to go to the distal portion of the humerus. She's going to resist me as I push down, and she'll push her arm up. Go ahead. Great job. Report 5. Today I'm going to be doing Tensor Fascia Latae range of motion. The Tensor Fascia Latae does hip flexion, hip internal rotation, and hip abduction, but today we're going to focus on hip flexion. The axis of rotation is the greater trochanter. The stationary arm is aligned with the midline of the pelvis, and the mobile arm is aligned with the lateral epicondyle of the femur. This action occurs in the sagittal plane, and normal range of motion for hip flexion is 120 degrees. The muscle we're targeting today is the Tensor Fascia Latae. I'm going to have my partner lie supine on the mat. We're going to go to the greater trochanter for the axis of rotation. I'm going to have you put your arm up. The stationary arm is going to be aligned with the midline of the pelvis, and the mobile arm is going to be aligned with the lateral epicondyle. When you're ready, go ahead and flex your knee and your hip. Great job. Report 119.